So, hello everyone. This is Dr. Akram here from Sydney, Australia. And today we are going to discuss the opportunities, how you can register as a dentist in Australia and what are the ways you can migrate to Australia. Okay. So, this is basically a very brief webinar, and this is more on like one-on-one. So, if you have any specific questions, and then you can ask me, or you can just type your question in the chat box. I will read and give the answer, or maybe you can just unmute yourself and can ask the question and on this webinar. So, at Academically, we provide assistance for all healthcare professionals like medical doctors, dentists, pharmacists, nurses, lab technicians. So any healthcare professional want to practice, want to register themselves as certified healthcare practitioner in Australia. So they need to complete some steps. These steps are like very common steps for everyone, like documentation verification number one. Then you have to go for test, then English requirement, then you have to file your EOI and visa. So this is more likely like same for ADC, same for AMC or any other exam. But today's webinar is more focusing on the ADC, as per Australian Dental Council examination, and how you can register as a dentist in Australia. So this is a little bit about myself. So I'm basically an Indian pharmacist, completed my diploma in pharmacy, bachelor of pharmacy, PharmD PB from India, and I worked there for some time. Then I moved to Malaysia, where I worked around 4 years as a clinical pharmacology lecturer. Then last 6 years, I'm living and working in Australia. I'm trying to create the awareness among the community to migrate to Australia. Okay, this is so I have basically a teaching experience in India, Malaysia, and Australia for clinical pharmacology for medical and pharmacy students. Here are some of the faculties for this ADC course. So if we see here, this is the one picture from one of the famous newspaper here in Australia. So the headline, if you can read here, they mention that Australian man saves 85,000 by flying to India for dental treatment. So the dental treatment is very, very costly in Australia because there is a lot of shortage of the this dentist in Australia. So you see this guy just need extraction, root canal, and tons and implant. These are the treatment he needs. So he met one of the clinic in Australia. So they quoted him the 100,000 Australian dollar the treatment for his treatment. Okay. Then he knows somewhere he search on Google here and there. Then he fly to India. He buy the ticket in both sides. He stayed 2 weeks in India in 4-star hotel, and he roam in India. No, altogether he just spent only 15,000, and he saved 85,000 Australian dollars. Is about roughly around 40 lakh Indian rupees he saved basically just to travel India for dental treatment. Dental treatment is very, very costly in Australia because of the lack of the dentist available in Australia. There is a high demand for dentists in Australia from this perspective. So the opportunities for dentists in Australia, Australia provide always permanent visa, PR visa. So permanently you can live and work here in Australia. So 190,000 visa for this year they will give for PR visa. And currently a lot of advertisement available on the job site. So in Australia, there is a number one job website called seek.com.au. So any professional looking any job, you have to go in that website. You can see. So currently on that website, you can see 2,200 job advertisement is ongoing on this website. So based on this website data, they are saying around this much job opportunities is there. And if you see next 5 years, 28%, this is the projection, or this is a productive growth basically for next 5 years. So 28% is one of the highest if we compare with other healthcare professionals like pharmacists. Pharmacists are around 9% the growth. Okay, and if you see the salary is very, very high for dentists, 180K. This is on an average salary in Australian dollar in Australia. Anyone practicing in Australia as a dentist. Job satisfaction is very high, 3.9 out of 4. So these are the data from seek.com.au. So you can have a look here, more opportunities here. So this If you complete this process, you will get a PR visa, permanent visa. You can migrate Australia with your family, with your wife, with your kids, husband, all together. You can live and work permanently in Australia if you complete this process. There are some other several other advantages. Yeah, I can say here the education for kids in our own country, like in India, another country like Pakistan. We are basically saving the money, for our healthcare or for the education for our kids, right? But here, education is free for kids, and also healthcare access is free. So if anything happened to you or your family, you no need to worry. You no need to pay anything for in any hospital in Australia. So these are the free and professional development. For example, if you are a dentist, if you want to do any short course, or you want to attend any workshop, you want to attend any webinar, and there is some fees. So that your clinic or your hospital, we will pay all this, or will bear all these expenses for you. So there is a chance for you. You can professionally, you can develop yourself in advanced technologies, or is there anything else? And work-life balance is a very in Australia, you just need to work around 38 to 40 hours weekly. Means 8 hours per day you have to work for 5 days. Okay, so you will get a lot of time to live with your family, friends, and your kids. You can give a lot of time here. Career opportunities here. This is in the there's a high demand for healthcare professionals in Australia. So you will get a fast track PR, fast track visa for permanent residency, including the dentist. And quality of life obviously is very high as compared to other countries. And here is standard of living with very high, excellent healthcare, diverse culture. So you can see here around people more than 120 countries people are living and working in Australia, making an attractive destination for many people, and high potential earning more than 1 CR easily you can make in Australia yearly as a dentist. So these are the steps you need to complete in order to migrate to Australia. The first step we call initial skill assessment, or we can say document verification for this from the ADC. So in this process, we will help you to complete this. So this is a step one process. So no need to worry. It's just a documentation process. They want to check your degree from where you did your BDS or your doctoral degree in dentistry, and they also want to check you must be a registered dentist in your home country, and also need basically a good standing certificate, good conduct certificate basically from your council. All these documents they want to check basically, when you are applying for initial assessment. Then is the next step is the step two called ADC written examination. This is a multiple choice questions based this exam, and we will provide the coaching for this 4 months to pass this exam. And number three, basically, then you have to pass the English test. We will also provide you the coaching for this English, like OET you can give on that PT or ILPT or OET, any test you can give. And after, so these three steps you can complete in your home country. So very easy for you to complete. And this for this you need to come to Australia to complete this process, a part two exam. And once you pass this, you will get a full registration and you are eligible to apply the PR visa. Okay. So there was some questions from the student side that when we can apply the PR visa. So PR visa is a permanent visa. You only can apply once you pass the both exams. Once you become you will get the full registration. Then only you can apply for PR visa. But once you pass this ADC one, for example, if you are coming on a study visa, okay, and you pass this exam and come on a study visa, maybe you are doing like Master of Public Health, Master of Health Management, MBA in Healthcare, whatever XYZ. These are the very affordable courses. These three. Rest of there are so many other courses also you can do. So for in that case, once you pass this, then you will get a job as you can find a job as a assistant dentist, and simultaneously you can prepare yourself and to give this ADC 2. So once you pass ADC part 1, within 3 years you need to pass ADC 2. So you have 3 years time to pass ADC 2 to become a dentist in Australia. So in general, basically within 6 months or within 3 months, you prepare yourself as soon as possible and give this ADC Part 2 exam. Academically will help you to complete all these steps. So these are the English proficiency tests. If we see, so as I mentioned earlier, you need basically IELTS academic or PT academic or OET you can give. So IELTS academic needs 7 band in the individual in all four basically these components, and same for OET need B or 65 individual in PT you need. So these are the documents required for this step one or document verification, like your degree transcript, work experience if you have any. But work experience is not mandatory. But if you just complete it and you are not working, so highly recommended for you to please start continue working in any clinic or any hospital. Okay, and valid passport need government ID proof, like for example Indian citizen like Aadhaar card or driving license or any other government ID you can use. And passport photograph you need, dental registration you must have registration, and good standing certificate as you need. So all these documents required from your side to submit to Australian Dental Council to complete this process, and then you need to write this ADC exam. Okay, so this exam they conduct yearly 2 times, March and September, yearly 2 times they conduct this exam. So this is the for this exam basically there's no negative marking, and passing marks require the grade A or B. Okay, and we will provide you the coaching for this around 4 months. So easily you can crack this exam in within 4 months. At least you need to study per day 4 hours for 4 months. You can crack this exam easily, and you are eligible to apply PR visa, permanent visa, 190 PR visa once you complete this process. Or you also eligible like regional sponsored PR visa like 491 or work visa 482, 494. And yeah, this is a fees. Our team will give you the more information, and we provide the financial loan options we have. We will provide you the 3 months, 6 months, 9 months, 12 months without paying any interest rate uh, 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 for the loan. Or you can go for the EMI options also we provide. We have some scholarships also, so you can just contact to our team for the more information. But if you have any doubt or any questions regarding the process, Australia, job, visa, or anything, you can discuss with me now. Here are some of the reviews from Academically. As I mentioned, we provide courses for all healthcare professionals. This is not just for the ADC. Yes, guys. Now we can see one on one, or you will find a lot of videos basically on our channel. This channel basically dedicatedly for the dentists and medical doctors only. So this is our official channel for ADC exam dentist. So you can subscribe this channel. You will get a lot of information, lot of videos regarding Australia process, jobs, visa, and ADC, and all those things. You will find a lot of questions, frequently asked questions we always cover in our podcast. So if you have any questions, you can comment on any of the videos. We will cover those questions in our next video. Yes, please. Yes, Adil. Hi, how are you?
Sir, Alhamdulillah, fine.
Yes, Adil. Yes, कोई क्वेश्चन है
अच्छा
आपका?
सर, क्वेश्चन ये है ना, जी
हम्म,
जी, क्वेश्चन यही है कि मैं ऑलरेडी एज डेंटल टेक्नीशियन हूँ ना,
हम्म।
तो क्या हम मतलब आगे जो एपीएससी की है ना, वो भी मैंने टेक्नोलॉजी में की है ना, डेंटल टेक्नोलॉजी में, हाइजीन में, तो क्या इसके थ्रू हम अपनी स्टडी कंटिन्यू कर सकते हैं वहाँ पर ऑस्ट्रेलिया से बीडीएस या एमडीएस कर सकते हैं वहाँ?
If you can afford the fees, do you know how much fees you need? You are a Pakistani, right?
यस, आई एम फ्रॉम पाकिस्तान.
हाँ, तो if you have 5 or 6 CR Pakistani rupees, you can do.
2 years.
It is a 4 year degree, dentistry.
2 year diploma.
So you are asking basically regarding the doctoral degree, right? 4 year bachelor degree in dentistry in Australia. I'm talking. So you can just go and visit any university website and see their individual requirement for the admission and
Okay.
fees and all those things.
Okay, sir. Okay.
This is why basically those are completed bachelor degree in dentistry and looking to migrate to Australia.
Okay, sir. Thank you.
Yes, Yogesh, any question from your side?
Yes, Doctor. So I have a question. So after we clear, ADC Part 1 and reach there in Australia, so getting a dental assistant job, is it easy or is it somewhat hard?
Even getting a
So
job in India, you are Indian citizen, not easy in India itself, right? So don't
yes,
target
sir. Yes, sir.
nothing is easy basically. Even 20,000 rupees in India after BDS getting that job also not easy, right?
Yes, sir.
Here in Australia also, but not a single student like those are coming here unemployed. Anything they are doing in Australia, they will get the job. So basically, in Australia, they need lot of people. You can see that this Australia is very big country, and the population is very low, around 3.5 CR population is equivalent to Mumbai or Delhi only. कि जहाँ का जो
Yes,
population है
sir.
बहुत ही लो है, यहाँ लोग बहुत चाहिए इनको, और इसका जो एरिया है मोर देन डबल है इंडिया से. नाउ यू कैन इमेजिन दैट कि यहाँ पर कितने लोग हैं, कितना यहाँ पर स्कोप होगा चीजों का. और दे फॉलो, दिस इज a high income country, they always follow WHO formula, like 1000
Okay.
population, how many doctors, how many dentists, how many pharmacists, how many nurses they need, so they have to fulfill
Yes.
that criteria.
Sure,
Lot
sir.
of jobs are available. As I mentioned that 2200 right now advertisement are available on the website.
Yes, sir.
It means there is a high demand.
Okay.
Okay. So you just need to complete the process, you will get the job. Jobs is not the problem.
Okay. So will I be working in private dental clinics or there are public dental hospitals where you can work, sir?
Anywhere you can work. In India, if you are registered, whatever you want, you can do. If you want to open your own clinic, you want to work in private clinic, or you want to work in hospital, you can do. The same for here. You are eligible.
Okay.
You can do in government sector and private sector. Can open on clinic if you got whatever you want, you can do.
Sure, sir.
And getting a
But
job in government
yes,
sector is very easy here because local do not want to work. Indians mindset basically for government. That's why they
yes,
want
sir.
to work. But others local they do not want to work in government because government pays salary very low as compared to private. So people
Okay,
are
sir.
here they work in private sector more.
Okay, sir. Sure.
Any other have any questions?
Not for now, sir. Thank you.
फातिमा कोई क्वेश्चन है आपका अभी और? Not just Fatima.
सर दीज कोर्सेज जो है MPH का जो कोर्स है फॉर एग्जांपल उसके साथ साइमल्टेनियसली कोई प्रिपरेशन कर सकता है लाइक वहां पर पढ़ने का पैटर्न कैसा है बहुत स्ट्रिक्ट होता है क्या
मैं
कैसा होता है?
तुमको बताया था कि भाई तुमको अभी पढ़ाई करना है अगर तुम्हें पास करना है, अदरवाइज तुम पास ही नहीं कर पाओगी. Because now you are free, you don't have much to do. If you are in Australia,
Right.
you have to attend your college. Again, simultaneously, you also need to work in Australia as a part time to support yourself. कि आपको खाने को भी
Right.
पैसे चाहिए, रहने को भी पैसे चाहिए, और जिस कॉलेज में आप पढ़ने आ रहे हो उसकी फीस पे करनी है आपको.
राइट
तो
राइट
आपके पास में टाइम
राइट
इसका नहीं बचता है. मगर अभी यू आर फ्री, तो अभी आप अगर प्रिपरेशन कर लेते हो एडीसी का, दैट इज द बेस्ट टाइम फॉर यू. एंड जैसे ही आप यहाँ पे आओगे, एटलीस्ट अगर आपने पास कर लिया पार्ट 1, आपको असिस्टेंट
जी
की
जी
जॉब मिल जाएगी. अदरवाइज आपको यहाँ और जॉब करनी पड़ जाएगी. अगर आपने एग्जाम पास नहीं किया तो आपको और जॉब करनी पड़ेगी. सारे बच्चे यहाँ पे
जी
करते हैं, बुराई वाली बात नहीं है, मतलब सारे बच्चे यहाँ पे करते हैं. मगर अगर आपने एग्जाम पास किया तो आप अपनी फील्ड में ही काम करोगे. एज असिस्टेंट डेंटिस्ट आप काम कर सकते हो.
राइट राइट राइट. और मैं ये ऑनलाइन देख रही थी सर कि रिटन एग्जाम यूजुअली क्रैक कर रहे हैं स्टूडेंट्स, बट प्रैक्टिकल आई एम सीइंग दे आर टेलिंग दैट इट दे डोंट पास एवरीवन. Practical is the
Why they have to
toughest part.
pass everyone? Why they have to pass everyone? If you are not basically competent, why they have to pass? So you have your standard
Mhm.
must be equivalent to Australian standard. Then you will pass. तो उसका फार्मूला यही है कि आपने एग्जाम एटीसी पास करो और ऑस्ट्रेलिया में आके प्रैक्टिस करो एज असिस्टेंट डेंटिस्ट की. आप देखो यहाँ पर ऑब्जर्व करो कि कैसे यहाँ प्रैक्टिस होती है, वही लोग अच्छे पास कर पाते हैं. मैंने आपको कल भी याद
Mhm.
बताया. तो
जी
बच्चे
जी जी जी.
यहाँ पर आधे डेंटिस्ट इंडियन है. इफ यू सी हाफ ऑफ देम आर इंडियंस बेसिकली डेंटिस्ट. तो जो जो पास करे वो भी तो इंडियन ही है ना, और उन्होंने भी इंडिया से
जी
अप्लाई
जी
किया हुआ है. तो बहुत सारे यहाँ डेंटिस्ट बेसिकली देसी हैं, इंडियन, पाकिस्तानी,
जी.
बांग्लादेशी.
हम्म. ओके सर, थैंक यू.
थैंक यू. यस, किसी का कोई और क्वेश्चन है?
Sir, so I have another one doubt. What may be the rough budget for the entire process in India, sir, which includes the initial assessment, ADP Part 1 exam and everything?
हाँ, तो इसमें ज्यादा नहीं होगा. मैं अप टू एडीसी पार्ट 1 if you are asking like skill assessment, then ADC, then English, even including our fees, maybe hardly 5-6 lakh.
Okay, sir.
एंड अभी आपको नंबर आपने छेड़ दिया ना, हमारी टीम अभी कॉन्टेक्ट करके वो बता देगी स्टेप बाय स्टेप कि आपको डॉक्यूमेंट प्रोसेस में कितने लगेंगे, फिर नेक्स्ट स्टेप में कितने लगेंगे, फिर इंग्लिश में कितने, वो पूरा बता देंगे आपको कुछ देर के बाद.
Yes, sure.
Okay. Yes. Apart from fees will give you, our team will give you one-on-one basically, because there is several steps are involved. तो गवर्नमेंट का ही बेसिकली मेन खर्चा है यहाँ पर, क्योंकि आपको डॉक्यूमेंट वेरिफिकेशन में पैसे पे करने पड़ते हैं, फिर आपको एग्जाम लिखने के लिए एग्जाम एडीसी को पैसे पे करने पड़ते हैं, फिर आपको इंग्लिश का एग्जाम करने के लिए फिर आपको इंग्लिश के पैसे पे करने पड़ते हैं ना. मैक्सिमम जो आर पेइंग अराउंड 70% जो कॉस्ट आ रही है वो गवर्नमेंट को आप डायरेक्टली पे कर रहे हो. देयर इज नो इन बिटवीन अस, एनी कोई एजेंट नहीं. वी आर नॉट एजेंट. We are an education company and you are just paying for us that course fees only, what we are charging. We are providing you the 4-month coaching. So, and we provide whatever assistance, it is free from our side. And those we provide basically for everyone. This is not for that. कोई भी medical है, pharmacist है, nurse है, lab technician, because we run all these courses only. Yes.
Hi, sir.
Hi. This is.
Sir, after getting registration, is it possible to do MDS in Australia?
Possible to do
MDS,
PG?
MDS.
Yes.
Yes,
For PG. Yes, it is possible. If you want to do, basically there are two things. So there is a clinical and non-clinical branch, right? So for example, if you want to do any non-clinical branch, then no need to go for IDC, you can do, but getting a job is very, very low chance or no chance. But if you want to do any clinical branch, so once you pass this ADC part 2, then you can go basically, you are eligible to apply. Once you've done basically registration, then you can, start looking on those kind of trainings here.
Sir, is it same as in India, like 3 years course? Or
No. This is totally different in not in India. India, like we have, for example, one test for like NEET PG, for example, कि आपको wherever you want to do any branch in India, you have to go for NEET PG, and based on your score, you might get in the college, right? But here in Australia, each university, they have their own criteria. So there is no universal exam in Australia. Okay. So in general, they will just see your CV, your previous work experience, and your interest and all those things, and they just conduct the viva, and they just give the seat allotment. Sometimes they will ask written exam, then viva, then they give the admission. So each university have their own criteria.
okay, sir. Thank you, sir.
And this is also depend on in which basically specialization you are going. So minimum will take 3 years or maximum can take 6 years. But this is kind of a fellowship. You will get the salary paid. So you are not doing free of free. Like in India, if you are doing MDS, so basically you are paying basically the fees to the college, and they are not paying anything for you, right? But here they will pay you.
Yes, yes. Okay, sir. Okay, sir.
But you have to work simultaneously in the hospital, when you are doing this uh, PG, because you already a registered dentist in Australia. Yes, anyone have any other doubt? संजना, कोई क्वेश्चन है आपका? इज एनी क्वेश्चन संजना? हसन अहमद, जवाद अहमद, एशली थॉमस. If no question, then we can finish. Please ask your question, or maybe you can type in the chat box so I can read and give the answer.
Sir, one more question, sir.
Yes, please.
Sir, if you're doing any fellowship course in India, is it valid in Australia?
No, you have to go. Basically, if somebody did, for example, MDS in India, you're asking, okay, you can be a specialist in Australia, right?
Okay, sir.
So you cannot, because you are not. You must be RMP in Australia. Then only you can go specialization here.
Okay, sir.
So you have to
Okay,
go
sir.
for ADC Part 1 and Part 2 and become get your general registration. Then you can do PG here. Many PG holders from India, they completed PG in India and they come to Australia and they did the same process, same exams, and now they are practicing as a dentist here.
Okay, sir.
And after that, there is so several certificates, several short courses also, not just the PG, like sometime 1 year, 2 years. There are so many diplomas also available in Australia to do super specialization in your field. See, if you have, please leave your phone number, email in our chat box, so our team can connect to you one on one. Also, they will give you the more information regarding the fees and all the process. Or if you want to see, how we are, and we are also going to conduct, I think, one master class, free master class. How we are going to conduct this kind of class and all that. I think it's going to be on after 1 week or something. We will inform you if you are interested.
Okay, sir.
So our faculties will take those and along with me.
Okay, sir.
Okay, guys. Then thank you so much. Arindam, can you finish?
Yes, sir. Just before we end, I think Jawad and Hardeep, they have joined us late. If they have anything to ask.
Please unmute or ask your doubt if you have any.
Hardeep and Jawad, you guys have joined late. If you
So maybe
have
I
anything
can,
to ask.
maybe I can brief.
Actually, I just got the link just right now, sir. That's why I joined late on my
Okay, so
WhatsApp.
I
It
can I
just
can
arrived right now, so that's why I've joined late. Actually,
okay.
just I have sir one question. What is the like exactly? I want to know about the theory part. How to prepare yourself for the written exam, because practical you have demo classes and you can
Basically,
arrange yourself for demo and all.
in
But
general,
for the written part, which books to follow, which mock test to give, which things to read and not
we
to
are
read.
here basically.
That's what I want to know.
This is we are here. We are providing 4 month coaching to pass this exam. So we will cover A to Z necessary in whatever necessary for to pass this exam. Live classes we will provide, study material, all the mock tests based on last 10 years question paper, each and everything we will cover in our syllabus. So you don't need to worry. We will cover each and everything. Yes, किसी का और कोई क्वेश्चन है?
No, sir. Just that only regarding the written exam. Thank you, sir.
Thank you. ठीक है ना, कर लेते हैं, कोई फिनिश कोई नहीं है कुछ, ठीक है।
Dr. Mohammed Abdur, if you have any question, you can ask. As I can see, you have joined late. Dr. Abdur, if you have any question, kindly unmute yourself. Okay, sir, I think we can end this meeting over here. Thank you, everyone.
Thank you.